Good day. The YMC Education Series is free and open to the public, so we encourage you to spread the word, invite your friends and families to enjoy these topics. We host approximately 6 to 8 of these a month, varying in all types of different themes and ideas and concepts and topics. This program will last about an hour. If you find you have any questions, feel free to put in the chat box and I'll get it to our speaker, Denise. Otherwise, please hold your questions till the end, and normally there's some question time at the end. Thank you again for joining us today. I would like to introduce Denise Schwartz. She's amazing. She's talked to us a lot about how to heal yourself, healing neck pain naturally. Do you wake up occasionally with a kink in your neck? Do you have trouble turning your head while driving? I know I do. So I am excited to hear about Denise today, talking from the manual touch. Welcome, Denise.
Thank you. Oh, that was quick. Thanks, Pam. I'm happy to be here. I am going to, I'm going to reiterate, as you know, these webinars, it's very hard to interact. So if you have any questions, put it in the chat box and we'll get to them at the end. Also, please put your email in the chat box so I can send you more information. That would be great. All right, hold on. Now let me share my, oh, here we go. Hold on. I got to get to the right. Oh, where is it? You know, all these little, there it is. Okay. One more. Give me a second. Slide. Okay, does that look good? Pam, maybe give me some feedback. And
looks great.
Okay, I just trying to find my pointer. Every time I use a different computer, it's somewhere different. Can't I ever find the mouse or the, what's this? Annotate, aha, mouse, okay. Oops. All right, Pam, can you tell me if you can see my mouse floating around, my arrow?
Yes, you can.
Okay, cool. All right, we are good to go. All right, and I turned my video off of myself as well, so I'm not seeing me and I'm not seeing anybody else. So I'm sorry, I'm not going to be able to answer any questions as we go along, but please save them for the end. I'll have plenty of time. As Pam said, my name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling, just outside of Northbrook at Milwaukee and Dundee. We use a whole body approach of traditional and non-traditional therapies to get people back doing what they love to do. I started my career many years ago at Lutheran General Hospital. I saw people in the hospital and and then within a year or two started just doing outpatient. When I got out of school, I knew that back pain was the #1 reason people went to see their doctor. So I took a lot of classes to become an expert in treating back pain, as well as neck pain, which today is about neck pain. This is a brand new seminar. I haven't done this before. So be patient with me if I find things that aren't as organized as I want it. You know, some things get tweaked as we go along. So I became an expert in back and neck pain, took a lot of other classes to become an expert in treating anything that anybody needs. And those were all what we call more traditional physical therapy techniques. Along the way, I started studying a non-traditional technique called integrative manual therapy. It is a whole body, hands-on approach to look at people as a whole person, looking at all structures in the body, how they interact, and all the systems. And what I found is some people who, particularly people with chronic pain or chronic illness, don't do so well with traditional therapy, but they did really well with the non-traditional approach. So I then left the hospital to become, to work for the company called Center for Integrative Manual Therapy. We had set up a clinic here in the Chicago area, and I became an expert and certified in integrated manual therapy. I was with them for about 7 years. And then we parted ways 12 years ago when I opened up my practice, the Manual Touch Physical Therapy. And I realized a lot of those traditional things that I wasn't doing when I worked for the center really are really good. And so I brought those back in and I combined the two. And so I use this whole body approach using traditional and non-traditional therapies to get people back doing what they love to do. Along the way, I had developed a passion for running and became an expert in treating runners and triathletes as well. Bulk of my patients I see, people usually come to me with pain, whether it's in any joint in the body, their shoulder, their elbow, their hip, their knee, their foot, sometimes headaches. I see people who have balance trouble, vestibular issues. So we see a wide variety of people here in our clinic. But today we're going to concentrate on neck pain, and lots of people have neck pain. And it's really debilitating when you have it. I know I've woken up with the kink in my neck, and usually I know what's causing it, and there is a quick fix for what I have. And so I've taught my husband how to do that. We're not going to get into that here, but if you come in to see me and you need that technique, I can teach you how to do that as well. So people with neck pain often they all have similar symptoms, but we have to discern what's really causing it. So oftentimes people will have pain just in their neck, in the back. It might be just on one side. It might be going up into their head. It might be going down their back. People may just have arm symptoms, numbness, tingling, weakness, pain. It could be just pain in the shoulder area. It could be, all of a sudden they can't use their hand very well. The biggest complaint is people like, I can't turn my head, they're like this, or they come in and they walk and they turn their body, all in one piece. And sometimes it's just to one side, like I can turn here, but if I go this way, it's like, that really hurts.
The phone.
No, it's upstairs.
Please bring
Those of you who have your microphone on, please mute it so the background noise doesn't disrupt. Thank you. Sometimes people will have dizziness or vertigo, and that could be coming from your neck. That's also one of those symptoms where it could be coming from a number of places, and one of the places it can be coming from, if it's not coming from your head or your inner ear, it could be coming from your neck. We call that cervical vertigo or cervicogenic dizziness. Also headaches could be coming from your neck. I actually have a woman now who has had migraines since she was a child, and somewhere along, and she's 32, and someone said, might be coming from your neck. So she finally decided to come in for therapy. She came in to see me, and she's actually, gosh, really only after 3-4 visits, down to one headache a week as opposed to almost daily. So we didn't know if that would be her primary area, but that was great. So you never know, it's worth giving it a go. People complain of difficulty sleeping, driving, sometimes walking, working on the computer, of course, putting a shirt on, doing their hair, writing, all those things. So when you come in, or when you go to see the doctor, or you come to see your physical therapist, we're going to ask you lots of questions about when you have pain, where is it, why is it, what might have started it. And then we go from there and try to figure out what's going on. So the 4 most common reasons I see people, the reason that they have neck pain. The number 1 reason is arthritis or stenosis. Number 2 would be a herniated disc. And actually the next 3 and 4 is really part of the musculoskeletal system, but I divided it out because sometimes it's just from the soft tissue around the neck or somewhere else in the body, or it could be really in the skeletal where there is an immobility somewhere in one of the bony joints. And I'm going to talk about each of these in a moment. But first we're going to get into some anatomy and how your neck works and that sort of thing. Okay. So here is a skeleton, and we're looking head on. As you can tell, this is their face. Here is the front part of your neck. Your neck, your spine, where is it? Is divided up into 3 sections. Your cervical spine, which has 7 vertebrae. Then you have your thoracic spine, which has 12. And then you have the lumbar spine down here, which has 5 vertebrae. Down here is your pelvis. And down at the base of the spine is some fused vertebrae called your sacrum. And down at the very bottom is your tailbone, known as your coccyx. So here in this picture, we can see the front of your cervical spine. These bony area is the vertebrae. Here you can see a little bit of this gel area, that's your disc. You can see, you see this hole on the side of the vertebrae? That is where the vertebral artery that goes up into your brain goes through and down and connects to other arteries down around this area. What else can you see in this picture? So if we look down in the chest, this is your clavicle, your collarbone, and this is your first rib. Everybody is so amazed that their first rib is up here because they think of their ribs and it's like down here, but we have 12 ribs which attach to all those thoracic vertebrae. But this rib and these first thoracic vertebrae play a big role in how well we move our neck. And in fact, you know, not only just the first 3 thoracic vertebrae of the thoracic spine, but the whole thoracic spine and rib cage plays a big role in how well you can move your neck. What else do I want to show in the front? I did not bring, I don't think I have a picture of all the muscles around in here because there's so many and a lot of them are little ones. But what you need to know, something that people hear a lot about is something called whiplash, which would be a soft tissue issue. Remember, we talked about a musculoskeletal. And that is an actual, what happens is your head goes forward and back really fast. And you strain a muscle in the front of your neck. You might feel like the pain is in the back, but it's literally a muscle that goes down the front of the vertebrae in here. Whiplash, when you get a whiplash injury, you can also get a concussion because what happens when your head moves so fast, your brain kind of moves, doesn't quite go with it. And so you get like this shearing inside your head. And so that's how you get a concussion. Here is a side view of your neck. And you can get kind of a little picture. Here's your spinal cord. And it goes down through a hole through the vertebrae. So my next slide, I'll go to it now. This is if you cut off the front part of this vertebrae here, you can see how the spinal cord goes down the center between all of the vertebrae, okay? When you have stenosis, and stenosis is a type of arthritis, a stenosis means a narrowing of a canal. So this canal around the spinal cord gets a little narrower because it gets a buildup of bone. Most of the time it's not impinging on the spinal cord, but it impinges on the nerve that is coming off the spinal cord, that is coming off between each vertebrae. Does that make sense? Here you can see in the front of the cervical vertebrae are those discs. In the middle of the disc is what's called a nucleus. It's like a jelly-filled donut. When you herniate that disc, actually what's happening is this nucleus has shifted and applies pressure on the outside of the disc, and then that presses on the nerve that's coming off the spinal cord. Okay, let's see. And oh, the other thing you might want to know, what I didn't point out, let's see here. Can you see all the way up here? I got this, I got this
Yeah,
thing
you
up
can
here.
see.
Okay, I've got like the control bar is covering my spine picture. Anyway, but you can see how the jaw is right at the top of the spine. So sometimes, and it's very close. Here's your jaw joint, and here's the neck. You can actually see here's your jaw, and here's that first vertebrae in the base of the skull here. It's very closely related. And then your ear is like right here. And so there's always this big connection between all those pieces. And actually there's a connection between your vision as well. I always found this to be very fascinating. Oh, here, you can see a little bit better in this picture. You can see how close the jaw is to the top of your spine. So somebody who may be grinding at night, someone whose teeth aren't aligned very well, someone who has arthritis in the TM joint here might have neck problems as well. And you might feel something inside your ear. So here at the base of your skull are very little muscles, and they go from here to here. Interestingly enough, if you actually put your fingers on the base of your skull, so underneath your hairline right at the top, and if your fingers are pretty sensitive, if you look to the right and to the left, you'll feel those muscles firing. These muscles actually stabilize your head as you move your eyes and use your vision. So how many of you got brand new glasses and then all of a sudden you felt sort of woozy and off balance? It's because these muscles and your vision and the way you're looking through those glasses aren't quite integrated yet. You have to kind of get used to that. Sometimes I have people come in here and they've had neck pain for a while, whatever, and I'll ask them, when did you get glasses last? And they'll say that just before the neck pain started. So sometimes there's a connection with your vision. So we have to think about those pieces. Okay, I think I got everything with anatomy. We got your disc, we got the nerve, we talked about stenosis. One other thing I wanted to show here. Let me see, where's a better picture? I guess this would be our best bet. Okay, so you can see here these wings that come off of each vertebrae. Those actually have a name called your transverse process. And then these vertebrae sort of stack on each other. And where they sort of connect is called a facet joint. And that's where your nerve comes out between those facets. Okay. And I get a lot of people who have arthritis and degeneration in that facet. And that's a little bit harder to take care of. But a lot of times, I think some of the pain doctors will put shots in that area to bring the inflammation down. We'll do some hands-on work here to mobilize that area to kind of open up the space a little bit. But you can get arthritis in, it's called the neuroforaminal joint, neuroforaminal space, the facet joint. So if you get an MRI and you see those words, that's what they're talking about. Okay. And we'll probably come back to a little bit more of anatomy in a minute and how things work together. So we briefly touched on, so if you have arthritis or stenosis, usually the typical symptoms are pretty significant loss of movement. People come in and they can only move their head a little bit. It may hurt at the end point, maybe just one direction. They feel really stiff. Sometimes you have numbness, tingling, or weakness in your arm, usually both arms. Although it's interesting, when I see arthritis, I usually see people just have pain in their neck, not so much in their arms. When people have a herniated disc, they definitely have arm symptoms, okay? So we have to discern between the two. Pain in the neck or the arm, crunchy sounds, people really freak out about that. My neck is really noisy. I turn it and it's like crunching. It usually doesn't mean a whole lot. It's just scary sounding. I don't know if we ever figured out what it is. It's usually some pressure changes, usually some fluid. If you had bone on bone, like if somebody has, like a lot of people have had knee issues and you bone on bone and you might hear crunching, it is definitely the bones touching each other, but in the neck, sometimes that's the case. People with a herniated disc typically have an arm symptom. They will have some pretty severe, could have severe neck pain, but they might just have numbness in their arm, tingling. They might have weakness. Their reflexes will be reduced. So we know something is going on in the spine. So when somebody comes in and they have a decreased reflex in the arm, we know something is going on neurologically in their spine or possibly their brain. So, you know, we're looking deeper to see why are you having neurological symptoms? If you do have neurological symptoms, we definitely want a surgeon or a doctor to take a look at you. Oftentimes physical therapy can take care of that, but we need to rule out where it's really coming from and what's going on. Sometimes people do need surgery, loss of reflexes or sensation or weakness in the arm. Could be something going on in the brain. You know, we need to know, is it really coming from your neck or the brain, or is it actually getting an impingement somewhere else in the body? And I'm going to talk about that next, or somewhere else, not from the neck. So we got to rule all those pieces out. But typically, if it's a herniated disc, you're going to get you'll have some arm symptoms. You have neck pain. We usually can reproduce it. You know, oh, I turn my head, my arm goes numb. I turn this way, my arm feels better. So that's a reproducing of the pain. And the same thing with stenosis, you know, where can we reproduce the pain? When I turn my head is when I get it. When I sit here nice quietly, it goes away. When the pain never goes away, then we got to look at some other things. Sometimes it's just this, because when you get that neck pain and it's just really aggravating up into here, it can be pretty constant, but if we can make it worse doing something, then we know it's reproducible. Most often what I see, particularly in younger people, but I also see it in older people who do have arthritis, but they also have this as well. This is the person who comes in and said, you know, I think I slept funny. You know, they fell asleep on the couch with their head like this, or they woke up and they went, and now I can't move my head at all. What that actually is what we call an elevated first rib. So if we go back here, you see that first rib? It's connected to the first thoracic vertebrae. And what happens is you get like a spasm, muscle spasm up here in the muscle, and it kind of pulls this segment so it gets kind of stuck between the vertebrae and the rib. And when you go to turn your head, that segment, that upper thoracic vertebrae, remember I said that was pretty important for when you turn your head. In fact, when you turn your head, that upper thoracic vertebrae should move with your neck and head as well. But these people, and actually most people, when they're stiff in their neck, they turn their head, that upper thoracic isn't moving. And so when we get some in there and mobilize their thoracic spine, then they get some better cervical motion. But more specifically with the people with that first rib, they're just totally stuck there. And so that is what I call more of a skeletal problem. And usually what happens is that muscle kind of pulls on it and locks up the joint. And so the vertebrae itself kind of feels like it's moved a little bit and the rib is up a little bit. And so the way to take care of that, those people do not get relief from pain medication or anti-inflammatories. It really, the best thing is to get in there and mobilize this area to get better balance in there and kind of get it to settle down. A massage may or may not take care of it because that muscle spasm really has kind of shifted the joint so it's not in balance the way we want it. Other skeletal problems, I talked a little bit about TMJ, people having pain when they open their mouth or when they eat. They get ear pain or headaches. The cervicogenic vertigo has to do with lack of good balance between the joints in the cervical spine, particularly at those facet joints that I talked about. So when we get in there and we really mobilize their neck and get some good movement there, your head and your ears and your eyes and neck all start working together better. So then the vertigo can settle down. Okay. So the other musculoskeletal issue, which everybody has, which has to do with postural weakness. So let's take a look at, here is an ideal spine, which nobody has. Typically, this cervical spine curves inward, the thoracic curves outward, and the lumbar curves inward. As people age, this tends to flatten out. Some people get excessive thoracic, what we call kyphosis. Some people with certain kind osteoporosis will either have an excessive kyphosis or it'll flatten out. The cervical spine might flatten a little bit too. So that's just, everything is sort of collapsing a little bit. Or you might get what we call scoliosis. Like here, you can see there's a curve in that spine. So when we look here, so here's your ideal spine. All of your soft tissues, all your muscles, ligaments, tendons are in its ideal optimal space. You get a shift anywhere in here, then all those muscles, one side gets lengthened, one side gets shortened. Your head shifts here, your muscles get shortened in the front of your neck. Here, it tightens up back here. Here, if somebody is really shortened in their core and abdominal muscles, and so they develop weakness in the core muscle. And everybody actually who comes in with some sort of pain anywhere, truthfully, it's because their core is not working ideally and not strong enough. So we always, as you can see here, when you get a shift up here in your neck, look at how your neck has to adapt to what's going on down here and what's going on down here. And it's not showing in this picture, but a change down in here. So we always have to work down here in order to really get to heal up your neck pain and weakness. Sometimes people come in and they have neck pain, particularly people who are sitting at a computer all day and they're kind of like this. I get a lot of young women like that. You know, they've come out of school and now they're sitting all day long and everything kind of falls. And their neck, you know, we can massage their neck all day long, but until we strengthen them up so they can sit up straighter and you get support from down below, your neck pain isn't going to go away. So it's very important to strengthen up your core in order to strengthen up and get rid of the neck pain. Other issues that people might have, we talked about a stiff thoracic spine here. And this is as people, particularly men, as they get older, they really don't move in that thoracic area very well. Just getting that mobilized will, and the rib cage that comes around, this rib cage here gets very stiff as well. Remember, your rib cage is your body armor protecting the most vital structures, your heart and your blood vessels and your lungs. And so it stiffens up to protect it. But if you can't get movement in there, when you go to move your neck or your arm and you're not moving through that rib cage, you may strain your neck. So it's very important to work on mobility down in this area. The other thing that people don't think about is breathing. Typically, we breathe with our diaphragm, which is, you know, at the bottom of the rib cage. Okay, and then these are your lungs and your chest, so they have to come into play, but you want your diaphragm to initiate the breathing. Okay, But I get a lot of people who kind of breathe right here, and they use these muscles called your accessory muscles. People with COPD, people with asthma, people who don't have that. I've had other people who come in for whatever reason, they breathe with these muscles and they don't use their diaphragm the way they need to. And so these muscles get strained and then they have neck pain. So we often have to work on breathing to get you back to get rid of that pain and get your mobility better. So here's like posture, right? Could you imagine if one little rock is out of whack, this whole thing's going to come tumbling down. So that's why we have to look at you as a whole person and look at all the pieces going on, whether it's coming from your feet, your knees, your hips, your back, your core always. It could be, you know, where's your jaw sitting? Where's your head sitting? Okay. I hope I touched on everything as far as neck pain that I can think of, but if you have specific questions, please put them in the chat box and we can discuss them, because more than likely somebody else can benefit. And we talked about making sure it's reproducible, and then we can help you. And what is the biggest mistake people make with neck and arm pain? They ignore it. You know, the sooner you come in and take care of this, the easier it is to take care of the problem, particularly, well, with any case, you know, recently, I'm trying to remember, you know, somebody, you know, who woke up funky and it's just not great, or you can't move. If you get in right away, we might actually be able to take care of it like that. Other people, you know, it builds up slowly over time. But again, coming in sooner than later to really learn how to take care of it, see if we can reduce your pain, make you feel better. Ah, that's why I did that. Okay. So it's very important to do so. I thought I'd throw this in here. I don't know, it sort of gave me a good kind of a feeling about how important it is to take care of things sooner than later. I just did on a trip of a lifetime to Alaska. And here you see this marker, it says 2005, and this is a glacier. That's how far it's receded since 2005. It was just magnificent. If you've not been there, I highly recommend.
I'm not getting any sound.
So it wasn't to be political. It's just, I wanted to show off that I went to Alaska. But, you know, the sooner you take care of problems, the better it is, and the more that we can take care of it. It's important to figure out where the problem's coming from, because the diagnosis will dictate the exercise program. So I don't teach exercises during these programs because everybody's different. And of course, there's overlap and many people get the same things, but certain diagnoses are going to get something different than other people. And, you know, where do we start? So it's really important to figure out what's going on. Typically, you can come in to see your physical therapist without a prescription unless you have Medicare. If you come in and I feel you need more testing, I send you to the doctor. However, getting to the doctor is always a good idea. This is an ebook that I will send to you. Please put your email in the chat box, or let Pam know if I can have your email so I can get you these great tips on how to protect yourself so you don't wind up with neck pain. This is chock full with a lot of tips on positioning and how to move so you don't aggravate yourself. Here are some people who have benefited from physical therapy. This woman wrote about how she had multiple problems. So she broke her right arm and her hip. And she talked about how I showed her how all those pieces work together, and now she feels much better. This is a pediatric physical therapist that I worked with. and her neck was starting to get worse and worse. And through some of the skill treatments that we did here, she felt much better and was able to continue on becoming a yoga teacher in her second part of her life. This woman said, I had constant neck pain from a car accident 2 years ago. At my first appointment, I could tell that Denise was able to get right to the point of my problems. She had, after numerous therapy sessions, felt much relief of her constant pain, and she can sleep better and use less pain medication. This woman came in to me with a cervical disc herniation, and she had gone somewhere for PT somewhere else, but still wasn't able to turn her head. But after we worked with her here, she felt much better and was back to normal and back to work. So what happens when you come in for physical therapy? Well, we're going to do some hands-on therapy called manual therapy, where we're going to get in and make sure all the joints are in balance and moving as optimally as possible. Any soft tissue that might be aggravating the area, we will work on that. Sometimes it needs a gentle approach, sometimes it needs a more aggressive approach. Very important piece is we need to work on strengthening up your core and your neck muscles, and getting everything working together. We call that neuromuscular re-education, teaching your body how to work together. And then the most important thing is really teaching you how to stand properly, how to sit properly, really getting your posture in as optimal alignment as we can, which goes along with the strengthening and getting the balance between all of your joints and your soft tissues. So thank you for coming in today. I'm happy to provide a free phone call or a telehealth session to discuss what's going on with you and how we think we can help you. So you just give our office a call here at 847-541-7600. Here are some little tips that are in those ebooks, plus there's a lot more. If you get sudden onset or if you have neck pain, you can always use ice or heat. Doesn't matter what you use. Initially you want to use ice, and then you can switch to heat after a couple of days. However, ice is fine to continue as long as you want. I think ice works way better on your neck than heat, but people hate ice, so they use heat. It's fine. All it does is help manage the pain. Make sure you have a good pillow to sleep on. You want to make sure your head stays in a neutral position. So if you're sleeping on your side, you don't want your head side bent, so you should make sure it fills here. Do not sleep on your stomach. You can sleep on your back, that's no problem. I do not teach people how to stretch their neck by moving their head. I instead teach them how to mobilize their neck by moving below. Okay, and core strengthening. So a lot of you are YMCA members and go to the wonderful classes there, and I know they focus a lot on balance and core strengthening, and that will help you up here as well. Another Alaska picture, and this one is just to entice you to get out there and enjoy nature and connect with the world and enjoy yourself. And here's some more nature porn from Alaska as well. So I'm going to stop the share so we can chat. And let's see if anybody has any questions.
You have two or one.
We are in, someone asked about insurance and Medicare. We are in network with Medicare and Blue Cross. And if you are out of network, we will check your benefits. Well, we check your benefits with everything as well, because like Blue Cross, they must have a million plans, and everybody is different. So we'll check your benefits. And then out of network, we'll check what those benefits are. I also have a cash rate, so that is not a problem. And if you are on Medicare and you want to come in, if you have a good relationship with your primary doctor, or you've seen them recently, you can email them and say, my neck is acting up. I'd like to go to physical therapy. Can you write a script? for me. Most of the time, they won't make you come in. But if they haven't seen you in a while, or they don't know anything about it, they may make you come in. Those of you with private insurance, you do not need a prescription. Any other questions?
All right, if you have any other questions, feel free to message Denise or put your email in the box right now, or you can also message me and I can get that to Denise. Thank you.
Yeah, that would be great. You can email me or whatever, but I send out weekly emails with lots of great tips. And I'll send you this PowerPoint presentation and an ebook.
Awesome.
You're quite welcome. I got some nice thank yous from people, so appreciate it. And if you have any feedback or about it, it'd be great, because this was a brand new one. It felt pretty good, but in case I missed something, let me know, or it seemed a little disorganized or whatnot.
Awesome. That concludes our YMCA Education Series presentation on behalf of the North Suburban YMCA and the YES series. Thank you for attending today and supporting organizations and programs like this. Special thank you to Denise for joining us and speaking to us today. Programs like this are free and open to the public. Check us out on our website, www.nsymca.org. And then thank you again to Denise about neck pain today. If you're interested, our next talk is Wednesday, November 30th at 7 p.m. Understanding Shoulder Pain with IBJI, the Illinois Bone and Joint Institute. Until then, we will see you probably in 2023 with Denise. So we'll see you next year with Denise. All right. Have a good
Happy
day.
holidays, everyone.
I'll see you.
Thank you, Pam. Thank you, Denise.
You're
Bye-bye.
welcome. Nice to see everyone. Bye.
Bye.